Welcome. My name is Peter Strong. I'm a professional psychotherapist. I offer online mindfulness therapy via Skype for the treatment of anxiety, depression, addictions, and particularly for help with obsessive-compulsive disorder. So this is very common. It's a very common problem. It's very distressing for many people, and this is something that responds very well to the techniques of mindfulness therapy. If you're interested in seeing an online therapist for OCD, then please reach out to me, contact me, and let's schedule a therapy session via Skype for your OCD. So the principle of mindfulness therapy is learning how to work with these intrusive thoughts and compulsive impulses. Mindfulness is a way of changing the relationship that you have to intrusive thoughts and emotions in general. It overcomes this habit of becoming reactively identified with thoughts and emotions. This is the primary problem with OCD. The thoughts get triggered and they appear in the mind, and then we simply become completely overwhelmed by them. We become identified with them. We become consumed by the thought, and then it tends to propagate and produce even more thoughts, and that feeds the underlying anxiety that fuels the obsessive thoughts. So the first step in mindfulness therapy is learning and retraining yourself to sit with the thought consciously, but without becoming identified with it and without becoming reactive. The process for doing this is meditation. We learn to meditate on those thoughts. People think that meditation is about escaping from the mind and thoughts, and it's not. That is not the kind of meditation that I teach. So mindfulness meditation is about learning to establish balance in the mind so that you can be free from emotional suffering no matter what thoughts arise in the mind. That's the primary focus for mindfulness meditation, freedom. So that's the first part of the training, and I will teach you how to do this, and you will learn how to meditate on your intrusive thoughts and how to re-establish this balance so that they do not overwhelm you. The second part of mindfulness therapy is really about looking at the image structure of your emotions, the emotions underneath the thoughts, the emotions that are fueling the obsessive, intrusive thoughts. And this emotion is primarily anxiety and fear-based. So we learn how to work with fear. And the most important principle that mindfulness can teach you is to learn how to bring compassion to that fear, because that is exactly what the fear needs in order to resolve itself and heal. You need to learn to develop a compassionate and friendly relationship with your intrusive thoughts. If you try to avoid your thoughts or suppress them or run away from them or even distract yourself from them, this will have the effect of reinforcing those thoughts and, more importantly, reinforcing the fear underneath those thoughts. You have to heal that fear if you want to heal from OCD. So the primary way we do this is by developing compassion and friendliness towards that fear. We learn to treat the fear the same way that we might treat a child. If a child is afraid, what does it most need? It needs the presence of the child's parent. The parent is not afraid. It needs to connect with a larger self that is not afraid. And that's how the child is able to overcome its own fear, by the presence and connection with something that is fearless. In mindfulness work, we develop this inner fearlessness. This is what we call your true self. And the true self is really nothing more than the observer within you that we train to sit with that thought or series of thoughts, or to sit with the fear and not react to it. It's training in non-reactivity. This is training in fearlessness. That is the nature of fearlessness. It is non-reactive by nature. So it is able to be present with the fear without reacting. That is your true self, and that is what we are developing when we meditate on our thoughts. You have to train your true self. You have to bring it out. It's already there, and always has been there within you, but we have to reawaken to our true self. So when you are able to bring that fearless quality of your true self to the fear, it's like bringing the parent to the child. And that's what really accelerates the healing of that fear, the resolution of that fear. So that's another very important part of mindfulness meditation work. And another part that we explore is to look at the structure of the fear itself, the emotion that fuels the intrusive thoughts. Without that emotion, those intrusive thoughts would not remain in the mind. They would simply disappear quite naturally, because there's nothing that's keeping them there. There's no fuel. So the emotion of fear, like any other emotion, is based around imagery. There is a certain habitual imagery that gets triggered in your mind, and that is what creates the fear. So we need to uncover this imagery, which we do by meditating on the fear. We get to see the imagery, and then when you see the imagery, you can help it change. You can explore changing the imagery so that the fear resolves itself. This is a very important part of mindfulness therapy that we call mindfulness-based image reprocessing. It's the same process that we use when we're working with PTSD and recovering from very distressing traumatic memories. Same process exactly. We look at the imagery itself, how it works, and then we explore changing that imagery into a form that no longer triggers emotional trauma. If you would like to get started with me and schedule some online therapy sessions via Skype, then please contact me and let's set up a session. The mindfulness approach is really effective for working with intrusive and distressing thoughts and OCD. So most people who I work with see quite remarkable changes within 3 or 4 sessions. Once you start learning how to apply mindfulness yourself to work with your fear and with the thoughts, you'll rapidly see progress. And that's the focus of mindfulness therapy, is to teach you how to work with your emotions and thoughts more effectively, to give you the tools to do that. So please contact me if you'd like to get started and you would like to overcome your OCD using mindfulness therapy. Thank you.